start. I now yield 5 minutes to the gentlewoman from California, Ms. Chu.
Dr. Swagel, thank you for being here with us today. As a member of the Ways and Means Committee, I've made it my mission for years to lower the cost of prescription drugs. It's unconscionable that Americans pay the highest prices in the world for the exact same drugs. People with diabetes have to pay triple the cost for insulin compared with those living in countries like Canada. And now 1 in 5 seniors struggle to afford their medications. That's why it was so significant that when the House passed the budget reconciliation bill, it included provisions to lower prescription drug costs by allowing Medicare to negotiate prices for certain high-cost drugs. And it also penalized drug makers for hiking prices faster than inflation. It lowered out-of-pocket expenses for seniors and capped the price of insulin at $35 for those covered by Medicare and private insurance. Well, the CBO estimated that these provisions would result in nearly $80 billion of savings in Medicare and would reduce the federal deficit by nearly $300 billion. So, Mr. Swagel, can you explain how these provisions would not only reduce federal spending, but also lower prescription drugs for Americans?
Oh, yes, of course. And this is first from our cost estimate for HR 3, and then, as you said, inside the Build Back Better Act. The provisions in Build Back Better and HR 3 would set up a system of negotiation between the Secretary of HHS and drug companies. The Secretary would have very substantial leverage in the form of an excise tax. We've done substantial modeling for that. We've put out working papers that explain the technical details. We find that would lower drug prices. The lower drug prices would have many effects. Some of them would be health. People would take more medicine and have healthier impacts that would save money on doctors and hospitals. The lower drug prices would save money for the federal government because the cost of health insurance would be lower, and the federal government subsidizes health insurance through a variety of ways: employers, the ACA, Medicaid, and others. So the system in that bill, by lowering drug prices, would both make people healthier and save money for the federal government.
Thank you. And now I'd like to ask about paid family leave. As you know, the U.S. is the only country among 41 nations that does not mandate any paid leave for new parents, according to data compiled by the Organization for Economic Cooperation and Development. Democrats in the House tried to rectify that by passing a national paid family and medical leave program. Your analysis of that proposal found some important things. First, having access to paid family and medical leave could improve physical and mental health for some workers. Second, while some employers might reduce their company paid leave policies and shift to the federal program, that's not a bad thing for workers. Employees would still get paid leave, and you found that employers would increase pay or provide other benefits to attract good workers. Could you expand on how a federal paid family leave program might help increase pay for workers?
No, that's right. So we've done a lot of work on this, including a set of slides in 2021 that went through the various dimensions in which paid leave would affect workers and affect the fiscal situation. And as you said, that might lead some people to come back into the labor market, people for whom who are taking care of family members or loved ones, parents, and the availability of paid leave would make it possible to come back into the labor market. For people already working, it would give them added flexibility. It might change the way they're compensated. So there'd be lots of different economic effects. We had that in the cost estimate for Build Back Better, for the Build Back Better Act, as passed by the House of Representatives. We had that as costing the federal government $200 billion over 10 years. That's from 2022 to 2031. So there'd be a fiscal cost, and as you said, there'd be implications for families and for the economy.
And just quickly, one of the drivers of increasing deficits and debt over the decade is the aging of the population. How would immigration reform help keep our promises to our seniors?
So as you said, as the decade goes on, as we get out into the long-term outlook, the aging of the population becomes an important driver the fiscal challenge, both through Social Security and through Medicare. Immigrants make substantial contributions to the U.S. economy. The immigrants who are here and new immigrants, if people of working age come in, they would tend to pay into the trust funds supporting Social Security and Medicare. They get benefits. Those would be off into the future. Of course, they boost growth, they boost innovation, they boost our society in other ways. So of course, it's up to policymakers. CBO doesn't put forward policy recommendations, but increased immigration has many effects on the economy and on the fiscal trajectory.
Thank you. I yield back.
Gentleman